Hey guys, welcome back to Densitae Hair Transplant Center. This is Dr. Jadhao. I'm a dermatologist, hair transplant surgeon, as well as anesthesiologist. I'm practicing hair transplantation since last 10 years. So I have seen a long era of hair transplantation starting from FUT to advanced real-time FUT Sapphire. So I am facing a very common questions and that I want to answer on a common platform. What exactly hair transplantation cost? Why it is changing from year to year, why it is changed from person to person, why it's different from one surgeon to another surgeon. So we are going to discuss about that today in depth so that you will come to understand why the change in the price for hair transplantation in a different region as well as different places. Okay, so the first point we discuss here about qualification of the doctor. Second point will be the expertise, like how many years of experience the doctor is having. Third thing is artistic look, what the doctor is going to give with the patient. Next point will be a technique, what doctor is going to use during the surgery. Next point will be setup cost, like what kind of setup the doctor or the clinic is having. Next point will be what kind of baldness patient is having. So this is a broad spectrum what I have given to you, which cost you more. Okay. So the first point here, we are going to discuss about the qualification of the doctor. So when the doctor is qualified, definitely is going to charge better than anybody else who is not qualified. Like in India, we can consider plastic surgeon, dermatologist, and MDs maxillofacial are considered as a qualified doctor for hair transplantation. Other than that, maybe a BDS, BMS, BHMS, or maybe a technician, those who are running the centers might not charge you more compared to the doctors, what they are qualified. Second thing is expertization. See, we need to understand here what is the experience in this field. Because every plastic surgeon may not be doing a hair transplantation. All dermatologists are not doing hair transplantation. And all MDS maxillofacials are also not doing hair transplantation. So here the point is very, very important, how many years of experience the doctor is having in the field of hair transplantation. Because this is one of the topic which is not broadly covered when you are doing a post-graduation. So I know so many doctors who are qualified, but they are not able to do a hair transplantation. With the degree, the expertization never comes. You have to spend so many years doing such a particular surgery with the good efforts so that you can be master into that. So I can tell you that expertization is very, very important. Experience is very, very important when you are choosing any doctor who is also qualified. Coming to the third point. What is the natural look provided by the doctor? So I always say that hair transplantation is an art. It's not a routine surgery what you do usually. Like all the doctors who are surgeons are normally doing some surgeries without any hesitation. But in hair transplantation, this is an art. This is a cosmetic surgery you can consider when you are looking at this. But I feel this is more self-confidence giving surgery. It is promoting more self-esteem. It is giving you more confidence in the people when you are roaming around. So this is not only the cosmetic surgery, this is a mental block removing surgery, I can say. So try to understand the artistic approach of the doctor when he is designing your hairline, when he is designing your density, when he is trying to cover your baldness. So all the patients are not same patient. Everybody doesn't have the same baldness. So when you are choosing the doctor, try to understand what is his natural hairline is all about. How the density, what is the angle the doctor is trying to give. So what I feel is most important thing here is going to be what the kind of look after hair transplantation you are getting. Whether it is very obvious that somebody is looking at you and just identifying that you had a hair transplantation, or what exactly it is that nobody is able to understand whether you had a hair transplantation or not. So that difference is there when somebody has that artistic hand. So this is very important point. Next thing is a technique. What kind of technique is doctor is going to choose for you? Like if you go for a sapphire technique where cost might be little more, where you have to use the updated instrument. If the doctor is going to do a surgery with some implantar pain, that will cost you a little more. Some doctors are trying to use the best latest punches where the scarring will be very minimal. In those cases, they have to import it from some other countries like Turkey and US, where that will cost you a little bit more. So instrumentation as well as the technique might cost you a little bit more when you are considering your hair transplantation. So how many people are going to involve in your hair transplantation, where if you can involve only maybe a 2 or 3 person, where FUT might require maybe more than 6 to 10 person. Combination will require again more people to be involved into the surgery. So the cost might go a little higher when you are considering a different approach of the surgery. Next point, setup cost. Like what kind of setup the doctor or the clinic is having, what kind of setup the doctor is carrying. So it is very important to have all the basics, amenities, where if something goes wrong, you must have seen so many patients having some adverse effect of hair transplantation. Somebody might have lost his life. But important thing is that you should have all the emergency equipment ready into that setup, and it costs something for the doctor also. So if you're doing a hair transplantation in a normal setup where it's a saloon kind of setup, the cost will be less. But if you're trying to do it in a good hospital where anesthesiologists and other emergency measures are available, that will cost you a little bit more. So this is all about the setup. Coming to the next point, what kind of baldness patient is having. If somebody is a grade 7 bald, where the graft requirement might be 6,000 or 7,000 graft, it might take 2 days, or somebody might try to finish. If you have a good donor area, they might use your donor from the scalp as well as from the beard, and that might cost you more because more area has to be covered, more effort has to be put in. So that might give you more charges that might be you have to pay for the same. If you have any other adjacent condition like medical, like if you have a heart attack, so you might need to keep a doctor standby, maybe an anesthesiologist or maybe a cardiologist, tackle the problems occurring during the surgery. If somebody is having diabetes, then you might need to handle that problem in a different way. So these are other conditions where the charges might be. So when we come to the cost of hair transplantation in India, the cost depends on naturality, what kind of natural look, natural hairline, natural density a doctor can give. That what I feel is more important than anything else. If you try to do a hair transplantation somewhere and that will not give you a natural look, natural density, and that will not help you to boost your confidence or self-esteem, or that will end up into having more frustration, then that will be the most devastating condition what you are going to face. Because donor is very important. Once you lose the donor, again the chances of getting more donor area is very less. So important thing is you have to give the time to the clinic, you have to give the dedication to such the clinic which can give you the best natural hairline, best density and best angle. Important thing is more comprehensive approach. So I've seen a doctor is giving a good result, but the problem is happening after 2 years. The longevity of the hair transplantation never remains in some cases. Like somebody has done a front transplantation and again after 3 years or 2 years he lost his all the backside area. Again he became bald. Again he has to go for a hair transplantation. So the comprehensive, a complete approach of hair transplantation with the medical management of hair fall is needed. So many clinics are only just doing hair transplantation. Either they are just doing FUE or they are doing FUT. I feel the clinic should do all the cases like FUE as well as FUT, as well as very important is preserve your existing hair so that you become not bald again in the next 1 or 2 years. So this medical management of your existing hairs is very important when you are treating patient with the hair transplantation, because most of the hair transplantation hair will retain, but your existing hair will fall. And again, you might need one more transplantation, but that time you may not have the sufficient donor area. So try to understand these two things, a comprehensive approach to treat the hair fall as well as hair transplantation, along with naturality of hair transplantation is very, very important when you consider a hair transplantation. The range you can consider, you might get a good hair transplantation between rupees, INR, you can say 30 up to maybe a 150 to 200. It's all depend on the doctor's qualification and his expertise, and very, very important is a way of giving a natural look to a patient with a good hair transplantation. Hope I have considered all the topics here. I have cleared all your doubts. If you have any other doubts, if you have any other queries, you can drop me a message. Thank you very much.